Very much, everyone, for joining us for this week's County Media Briefing. My name is Rich Madalino. I'm the Chief Administrative Officer of the Montgomery County Government. I'm filling in this week for County Executive Mark Elrich, who is in China as we speak on a trade mission to China and Japan over the next few days. This is his seventh trade mission since he became county executive. I know the county executive often talks about the importance of bringing foreign businesses here and enticing them to Montgomery County is a wonderful place to have a U.S. Headquarters, an entry point into the country, and returning to some of the same communities and businesses to build those relationships and let them know throughout Asia, Europe, Latin America, Montgomery County, Maryland is a wonderful place to do business and to access the American market. So, unfortunately, because he is 12 hours ahead of us, he is unable to join. So, I am fortunate to be joined today by our outstanding U.S. Representative, Congressman Jamie Raskin. So, we are at the Silver Spring Center for the Montgomery County Department of Health and Human Services. Jamie is here today, Representative Raskin is here today to talk a little bit about the impact of the various cuts that are scheduled to take place to tax credits that impact people's ability to afford health care through the health benefit exchanges. Get a chance to meet with some of our incredible navigator staff, to learn a little bit about what they're seeing and the questions that are being asked, and to highlight what is happening in Montgomery County because of this work, and how many people might lose coverage in Montgomery County, in the state, and around the country if these tax credits are not extended. So I want to make sure that Congressman Raskin has a few moments to talk about what he saw today, what he's concerned about, the work that he's doing, and at the same time, to talk a little bit about the amazing rallies that occurred across our community, across the country on Saturday for the No Kings March. I know somehow you were out on the streets of Montgomery County and yet were the keynote speaker in Philadelphia in person at the same time. So, to talk a little bit about the energy you saw and how people are aggravated with what is happening in the country. They're coming out. I mean, I saw large groups on Connecticut Avenue, on 355 in front of Strathmore, thousands in front of Leisure World out demonstrating, little demonstrations.
Huge one in Olney.
Yes, yeah. and well, everything big in Olney happened.
Yes.
But we saw, again, 22 different demonstrations across the county. So, Congressman Raskin, what did you see today? What do you want the people of our community to know? And of course, whatever else you want to talk to the people of Montgomery County and the local media.
Well, thank you, Mr. Acting County Executive, in lieu of Mark Elrich, and hello to Mark if you're tuning in from somewhere in China. But it's a thrill to be with you. And let me say a word about what happened over the weekend with the No Kings rallies, which were just so extraordinary. There were more than 7 million people across the country who participated. There were tens of thousands of people from Montgomery County participating everywhere, from going down to the mall, to Washington, to the highway overpasses with Joe Erdman Faust in Silver Spring, to NIH in Rockville, where Senators Van Hollen and Alsobrooks were, to Bethesda, Kensington, throughout Rockville. Really just amazing what was happening all over the place, and Cabin John. That the story of this really was the people who came out, and it was such a manifestation of positive popular emotion and patriotism to defend our country. And so I was really disappointed in my colleague, Mike Johnson, who spent the week before saying that this was a Hate America rally. We already saw the Hate America rally. That was on January 6th, 2021, where they unleashed a violent insurrection against the Capitol, against the Constitution. They wounded and injured more than 140 police officers. And there were officers from Montgomery County as well as from DC, other parts of Maryland, Virginia, who were out there. They chanted, hang Mike Pence, and they tried to overturn a presidential election. That's what a Hate America rally looks like. What we saw over the weekend was a Love America rally. It was a Love America movement, and that is a movement that's opposing all of the authoritarianism. Now, speaking of which, the authoritarianism we're dealing with right now is a massive assault on the healthcare rights of the American people. We don't have one national healthcare system like they've got in Canada or in most of the advanced industrial democracies. So we've got the Medicare program, we've got the Medicaid program, we've got the Affordable Care Act program with the tax credits. Okay. And then stuff at the state and local level, fortunately, we have here in Maryland. But the point I'm making is that we need to be solidifying and beefing up this kind of program until we can get to what I hope will be a national healthcare system. But in the meantime, we shouldn't be turning the clock back. But that's exactly what my Republican colleagues have done. They've shut down the government, they've shut down the Congress, all so they can defend their shutting down of Medicaid coverage for millions of people and shutting down people's ability to pay their monthly premiums under the Affordable Care Act. Now, these tax credits have been absolutely vital for people's ability to participate in the ACA program. I've got 45,000 people who are my constituents in the 8th District who've enrolled in the ACA program and get the tax credits. That enables them to make ends meet. They wouldn't be able to afford it otherwise. That's why they're getting them. Well, by pulling the plug on the monthly premium tax credits, the subsidies that we give people, the Republicans have caused premiums to go up more than 100% across the country. In some places, more than 200%. In some places, it's tripled how much people have to pay. In Maryland, it's going up 40% just because the state has moved in to try to repair the damage by filling in, and not even for everybody, but for the people who need it the most, the state is able to move in. But still, the tax premiums that people are seeing, the insurance premiums are going up by thousands of dollars. And so that's why it's an emergency. So you created this tour for me, which I very much appreciate. And we got to meet with people who are on the front lines of this crisis here, like Dr. Ashford, who's the chief of public health services, Vinnie DeMarco, who's a longtime healthcare champion, came. A bunch of my constituents came to talk about how pulling the plug on the ACA tax credits is going to affect them. But what we need to do is to get my Republican colleagues to come back to Washington to end this paid vacation they've been giving themselves. And I call it that because they're not having town hall meetings. If they were, they would know the anger and the upset and the anxiety that's out there about all of this. So they're not having town hall meetings. They're not in Washington working. I don't know where they are, but they should call off the vacation, come on back to Washington. Let's reopen the Congress. Let's reopen the government, and let's stabilize the situation so we can continue the healthcare coverage that we've got under the ACA tax credit program. And with Medicaid, I mean, the Medicaid thing is unbelievable. They did a $1 trillion cut to Medicaid and Medicare in the country at the same time that they passed a $1 trillion tax break for billionaires and the wealthiest people in the country. And America is waking up to what a moral assault this is on the underpinnings of our society. So I appreciate your putting together this very fine group of doctors and public health specialists. And I appreciate all my constituents who came out to participate in this, because we were able to show how dramatically it's going to affect even Montgomery County, where the county has done so much to invest in public health infrastructure and where we have the benefit of the state trying to help out, but it's going to be devastating here. And it is going to be extra devastating in the red states around the country, which have not made the same kinds of investments that we have, Rich.
So one of the people who we heard from during the briefing was Vinnie DeMarco. Vinnie DeMarco, for people who don't know, Vinnie is a healthcare hero in the state of Maryland. Long led efforts to expand access to healthcare through Maryland Healthcare for All. So, and Vinnie brought up something that he talked about with the former Speaker of the Maryland House of Delegates, Michael Bush, someone we both have the honor to work with. And Speaker Bush said, you know, uninsured people are a hidden healthcare tax
On everybody else.
Yeah. And, you know, I don't know if you want to take a moment to talk about how, you know, these cuts to Medicaid, these cuts to the tax credits that help people get on the Affordable Care Act, that's just going to leave more of your constituents, our residents, our fellow Americans, without health insurance. It's not suddenly going to make them healthy.
That's right.
They're going to still have to turn somewhere for health care, and we are all going to pay for it. And I remember early on, the Secretary of the Maryland Department of Health under prior Republican Governor Bob Ehrlich, who said when cutting health care in Maryland, well, the hidden healthcare tax will flow through to premiums. And we like that because people hate insurance companies more than they hate the government. I mean, it's all a shell game. You're going to pay for it one way or another. And just what you said, these tax cuts to the wealthy, pushing people off of healthcare, all in the end, we're only going to pay more. The most expensive way. We're going to pay more in our premiums as opposed to Medicaid for all, which would be the cheapest option for healthcare in America.
Right. Okay. So let's say you actually didn't care about the people who are about to lose their Medicaid coverage. Let's say you didn't care about the people who are not going to be able to participate in the Affordable Care Act anymore. How is it going to affect everybody else? Well, the first thing is with millions of people across the country here in Maryland. I don't know if they've got the exact numbers, but I know I'm going to tens of thousands of my constituents are going to be losing their coverage. You add all of that up, what does it mean? A sicker society, right? Even if you don't care about those people, whoever you imagine those people to be, what it means is there's going to be a lot more disease, a lot more sickness. We saw during COVID-19 that my health status is connected to your health status. So that's number one. Number two is if you ever go to an emergency room, do you want the emergency room clogged up with people who have not been able to see a primary care doctor because they don't have coverage anymore? But then your point is so correct, Rich, which is that everybody's health insurance premiums are going to go up to pay for the people who are showing up in the emergency rooms with some kind of healthcare crisis too late. And it's going to be a lot more expensive. It's a lot more expensive to show up when you're, stage 3 breast cancer than when you're stage 1 breast cancer.
Well, and we heard that from Dr. Peralta, the head of the Casa Rubin Foundation, a clinic here in Montgomery County, where she told the story of one of her patients, Mary, who, because of lack of insurance, because of lack of the ability to get care several years ago, died at the age of 38 from breast cancer.
With 3 kids.
With 3 kids, but from a condition, if she'd been able to get to the doctor, and gotten the care, she could be alive today.
Right.
And that's the point that I know you make.
And this woman had been privately employed before, so she had health insurance through her job. She lost her job, and then suddenly she's without health insurance. Now, either we can make it affordable for people to purchase their own through the ACA, Obamacare, or we make it unaffordable. And the Republicans just want to make it unaffordable, and they're going to drive all of these people off of health insurance with these terribly detrimental effects across the whole society and economy.
As the county executive says, many people say the reality is people will die as a result of these decisions.
I should say one other thing. There's been a systematic attack on scientific and healthcare research at NIH. We've been fighting that from the beginning too. And don't forget about the role of RFK Jr. here, because they are also trying to dramatically limit the vaccinations that children get and the availability of vaccinations in different programs throughout the country. So we're going to have more outbreaks of disease, like the measles outbreak, which is taking place in Texas right now, and less ability to combat it because they're throwing millions of people off of their health care.
I realized as I was listening to you before that there is a fine print to make America great again, and that's for those fortunate enough to survive.
Yeah,
And that.
and I'm not sure how great it's going to be for the people who survive either.
Okay, so I could keep asking you questions and going back and forth. I spent years doing that, so that was always wonderful.
You did indeed.
But I know there might be people online who want to ask questions. Can you, if there's a reporter online who wants to ask a question, please raise your hand. Ms. Jacoby and Sholey. So I know we sat at this very building and you tried to explain your first name to me, and I'm horrible that I can't remember how to properly say it. So.
It's okay. It's Chaley Jacoby. And Congressman,
Hello, Ms. Jacoby.
I wanted to ask you a question about something that came up at a council meeting last week or the week before. It was a briefing on sort of the effects of the Big Beautiful Bill on various sectors in Montgomery County, one of which was the nonprofit sector. And they cited some data that they attributed to your office about the number of grants and other contracts that had been revoked from Montgomery County businesses and nonprofits. And I was just wondering if you had any more information about like the kinds of nonprofits or businesses that are being most affected by the cuts or anything like that.
Well, I'm here with some of my staff, and I'd love to see if they know specifically what you're referring to, and if we've got some numbers on that. But let me just speak just holistically about the situation. We haven't even mentioned the assault on the nutrition programs, the SNAP program. So somewhere around 40 million Americans are going to lose their access to benefits, to nutritional benefits under SNAP. That places extraordinary new pressures and burdens on the soup kitchens and Meals on Wheels and all of those programs, at the same time that the Republicans in Congress have been trying to pull the plug on funding for those programs and have dramatically reduced funding for those programs. So I'm not sure if you were referring to the food and nutrition ones. Obviously, the same situation of tremendous stress in the housing programs across the country, with the big cuts that have come to HUD and Section 8 and the other housing programs. But I'll see if we can pull up specific numbers that you may have been referring to. But I can guarantee you, just from the people I've been interacting with, very hard times in the not-for-profit sector, and we need to all step forward to support them as much as we can. And this is what makes me so proud of Montgomery County, that people are not just throwing up their hands at this point and lamenting how terrible this is. People are investing in the community and in the infrastructure we've got for public health, for housing, for food, and for nutrition for everybody.
So, Chaley, in your question, you pointed out so many mistakes that I made. First, not being able to remember your name, to properly pronounce it, even though I know you're with with the Montgomery Banner, the Banner in Montgomery. No. Oh my God, she's with Bethesda today. Oh my, I have just dug an even bigger hole for myself.
This is the press you're dealing with.
So can someone just, why doesn't the internet cut out right now? So Chaley, I did not say at the beginning that after Congressman Raskin leaves, we have some of our regulars on the press briefing with Dr. Keisha Davis, Dr. Earl Stoddard. So we can definitely get the answer to your question when they pop on. after Congressman Raskin is done, because certainly Dr. Stoddard was over, I think, the council for that briefing.
Sure. Yeah. It was a follow-up question that I think one of the council members had asked, and I wasn't sure if they had gotten any more clarification on it.
So I see people furiously texting off camera to try to get you answers, or to try to get me fired. I don't know what's going on. To apologize to your editor about not getting your publication correct. I do know you used to work for the Frederick News Post.
I did. That is true.
Right. Okay. I got something. I remembered something. So, all right. Next up, the dean of Montgomery County Journalism, Kate Ryan.
Hello, Kate.
Sorry, working to unmute there. The dean, that's another way of saying old. Thank you very much. And I actually will, to use the Hill parlance, yield my time, because I'm after the same information that Shaylee was mentioning about SNAP benefits. I believe it was the council president who mentioned that at the end of the month, we have enough to get us through the end of the month. Very curious as to how we'll manage. So I will ask that question when you get, as you said, the regulars. Thank you. Good to see you, Congressman.
Thank you, Kate.
So we did talk a little bit about that issue during the tour, as we were talking to some of the HHS staff about how, because of the shutdown, is the extended vacation that Speaker Johnson has put you all on, that SNAP benefits were funded through October, but they need that appropriation to make sure there's the money available for everyone's November benefits.
That's right.
And I know we're very concerned as a community. We have thousands of people on SNAP, tens of thousands of people on SNAP benefits in Montgomery County. There are other parts of the state and country that have a far greater proportion of people. And without that money, they're not going to eat.
Yes.
And, it's another reason why you got to get, and I know you would be there in a half an hour.
Yeah.
But we got to get the shutdown over so that we can get
That's right.
these things back and running.
I mean, a government shutdown, by the way, doesn't mean that Congress has to shut down. The Senate is in business, and we could be in business working to try to get to solutions now. And we need it because it's an emergency in the lives of people who are facing this healthcare calamity cliff that we're on. And it's an emergency in the lives of families that depend on the SNAP program and depend on nutrition. So we've got great local groups, including Tommy's Pantry, which are doing whatever they can to step up to help people. Groups like Small Things Matter all over the county that are working to help people. But of course, that we can't depend just on private charity to get through this. This is a public good, just like defense. We put $750 billion into defense, even when there's no war going on. And this is part of our defense against weakness and illness and disease and, nutritional problems. We invest in food for our people, and we should be the breadbasket of certainly the Americas, if not the world. We've got farmers who are trying to produce. We know they're being undercut by these terrible tariffs, which are illegal and unconstitutional. I'm hoping the Supreme Court follows through on these lower court decisions and gets rid of them. But in any event, we've got the food, we've got the wealth. We're the wealthiest country that's ever existed. We should not have people hungry. We should have children going hungry in our society.
Absolutely. And we're doing a lot of work in Montgomery County to make sure that does not happen. So next question, and my understanding is you have to leave at 11:45, so this might have to be our last question from Ginny Bixby, who is with the banner.
Yes, hi. Thank you, Rich. And hi, Congressman Raskin. I actually, in our office this morning, we were trying to figure out how many, and I don't know if this number exists, but perhaps if you know with your constituency, how many people have been furloughed in your constituency, or if someone from your staff can follow up with that number. And then to follow up, I was curious, what are the top 3 concerns you're hearing from furloughed employees contacting your office? Like, what are their immediate crises and their families?
Yes, thank you for that. We'll try to get the most up-to-date exact numbers on how many people have been furloughed. It's definitely in the thousands. I represent more than 55,000 federal workers, tens of thousands of federal contractors. And this war on the federal workforce has been taking place not just since the shutdown, it's been taking place since January when DOGE began to do its dirty work and tried to empty out the offices at AID, the Agency for International Development, has been attacking the workforce at NIH, at the Food and Drug Administration, the Consumer Financial Protection Bureau, you name it. And these are all constituents of mine. So for those people who've been furloughed during the government shutdown, during the last Trump shutdown, we passed a statute, and I was involved in working on this, to say that after the shutdown is over, furloughed workers will be paid for any time that they were put out of work. And similarly, people who continue to work without pay would be paid back fully. Now, President Trump has created some confusion about that, saying, well, we'll pay back some of them and not others, as if that's some kind of partisan principle. That is not consistent with the statute, and we're going to fight to see that everybody gets paid back. If anybody shouldn't be paid back, it should be Speaker Johnson and the House Republicans who are AWOL right now. They are not having town hall meetings in their districts, so they're not hearing from people. I don't think they're willing to face their constituents at this point, but somehow they just shut down the House of Representatives. And I've been at work all week. I was there yesterday with my colleague Adalita Grijalva, and I took her to the floor and tried to get her sworn in and to get a date certain set for her swearing in, but they gavelled us out before they would respond or recognize us. So it's tough times, but we're demanding that they come back, reopen the government, protect everybody's health care, and let's release the Epstein file while we're at it. And we should rehire the federal workers who've been illegally sacked during the shutdown. A shutdown does not confer any new authority on the government to fire anybody. In fact, they have less authority now because you've got to pay severance pay to people who are being sacked, and yet there was no appropriation for that. So we think that it's completely illegal to be doing it. In any event, we'd like to make that part of the negotiations to restore the jobs of the federal workers who were fired illegally during the shutdown.
Gotcha.
So,
Thank you so much. Oh, sorry.
We opened, Montgomery County opened what we believe is the first and still only in the nation job center for former federal employees in your district. And at that event, the state representative from the Maryland Department of Labor said that there were 56,000 Montgomery County residents had been furloughed. Now, obviously, there were more people in Montgomery County than just in your district, but that was the number that they provided last week. Was 56,000 people. And thank you again for highlighting, really the war on health that is occurring right now. Just, there are the dramatic draconian cuts to Medicaid and how that's going to flow to the working poor and to elderly people who will be kicked out of nursing homes. There's there's now this effort to make health insurance premiums through the Affordable Care Act and the healthcare exchanges unaffordable. And then, as you brought up, and as we've seen every day in the lives of people in Montgomery County, the war on the Food and Drug Administration, the National Institutes of Health, the vaccines, as you were talking about, Secretary Kennedy's approach to vaccines. I mean, it is so sad how they are trying to make so many Americans less healthy.
And they want to replace
Yes.
the best scientists in the world and the best healthcare in the world with online propaganda and disinformation and conspiracy theories. It's intolerable what's taking place. So we are indeed in a fight for the healthcare of the people and for science, and Montgomery County is right in the center of it. And I want to salute all of my constituents, federal workers, federal contractors, and other citizens who are in this fight too, for trying to defend all of our people against this onslaught. So I thank you for your support in this process. We are urging the Republicans to come back to Washington and reopen the government, and let's reopen healthcare and science for the American people.
All right. Well, thank you very much, Congressman Jamie Raskin, for coming by today and participating in not only the briefing before on the tour, but today's media briefing. Thank you for what you do.
It's my honor, Rich, and thank you for everything you're doing and all the great workers in Montgomery County.
But people, don't go anywhere online, because we are going to continue on with our briefing. So with our HHS crew, will be coming up to join the table. So online, I noticed we have Sean O'Donnell. We have Dr. Keisha Davis with us, Dr. Earl Stoddard with us. Let me see if I can make the frame big enough for the three of us. No, it's fine. It's fine. So anyway, Dr. Davis, have anything you'd like to add? I know you had a big day yesterday before the county council, and of course, we want to thank the county council for everything that they do in making sure that we have the resources to do the great things across all our county government.
Thank you, Rich. I will just give highlights. Yesterday, we presented the Board of Health update to County Council, so I'll just give a few quick highlights on that. This time around, we shared our chronic disease update, which we haven't given for a while. And in that, we saw that heart disease, cancer, and cerebrovascular disease are the top 3 leading causes of death in Montgomery County for both men and women. The good news in that is that COVID a few years ago was number 3 on that list. It has dropped to number 7. But the caveat is we know that having a COVID infection increases the risk for having some of those complications like heart disease and cerebrovascular effects. And we know that the safest way to not get COVID and to not have those impacts is to get a COVID vaccine. So we still encourage folks to get those COVID vaccines. This is a great time of year to do it. COVID is low, flu and RSV have not quite ramped up yet. So we still encourage everyone to get those vaccines. Some of the other things that we highlighted in the report when we're thinking about chronic disease, especially cancers, we looked at some disparities. And so we see in Black women, while Black women are less likely to develop breast cancer, they are more likely to show up with the disease at a later stage and more likely to die from it. And so raising awareness, especially in Breast Cancer Awareness Month, about the importance of early screening, getting connected to care, and being treated. What we also saw was in prostate cancer, while we have often talked about prostate cancer rates being high in Black men, what we also saw was an increase in late-stage diagnoses for prostate cancer for Latino men. And so we are working with our Latino Health Initiative and other community organizations to help get the word out for those screenings. Both prostate cancer and breast cancer, we know if they are caught early, people do much better. And so it speaks again to the importance of having health insurance to be able to get those screenings, the importance of Medicaid, Affordable Care Act subsidies, all of those things that keep people insured so that they can get these health issues addressed early for prevention. One other thing that we addressed was looking at some of the social determinants of health. And so we saw that Montgomery County has decreasing housing affordability, meaning it's more expensive to get a home in the county, and increasing food insecurity, which will only be worsened by the impact of SNAP and other food nutrition programs. We know that housing and food equal health. And so the importance of having those programs, having access to that in the county helps to impact the overall health of the county. We also looked at substance use rates as well as other mental health and suicidality. We are excited that we have continued to see a decrease in overdose mortality, 10% decrease in overdose mortality overall, a 3% decrease in fentanyl mortality. That's just in this year, calendar year 25. Calendar year 24, we also saw quite a significant drop. So we continue those efforts on decreasing mortality. We also recognize that those suicide rates have gone up a little bit, and Montgomery County averages higher than the rest of the state. And we recognize that we are going into a stressful time of year. This time of year, heading into the holidays, is stressful. We tend to see more mental health issues, and we are layering on top of that the added burden of federal shutdowns and insecurity. And so we recognize that this is a hard time for people. We ask people to think about your mental health, look out for those who are around you. Remember that we have 988 as a resource for people who might be struggling right now. And so this is a time when the community really needs to come together and support each other. And with that, I don't know if Mr. O'Donnell, Mr. COVID has any additional comments on COVID or other infectious diseases.
I just want to thank you. I just want to mention that in the discussion of insurance coverages, that all those with a recognized insurance, including Medicaid, Medicare, COVID vaccines are fully covered, flu vaccines fully covered. I believe the RSV vaccine is covered also for those recommended. Looking at the data from the state Immunet, last year Montgomery County residents got to 42% with a flu vaccination. It could certainly be higher. That means a lot of people with insurance did not get their flu vaccination. This year, we're already to almost 19% having that shot. So there's still a long ways to go. It's the perfect time to get your flu shot, to get your COVID shot. Again, if you've got that insurance, please use it. There should not be a cost to you to get it, and you'll be protected through the season. So we had, I think, it was about 5,000 hospitalizations in Maryland to COVID last year, and about 8,000 for flu. So very important to get these shots, and about 2,000 for RSV. So getting those shots helps prevent a serious illness and a hospitalization.
So I'm thrilled to say I'm already vaccinated for the flu, but how would I go about getting a COVID vaccination right now?
So most pharmacies are stocking the COVID vaccine, so you can get it at a local pharmacy. You can also get it at your doctor's office. You should not have any hiccups. So the Maryland Department of Health and the Secretary of Health have put a blanket order that anybody who wants the COVID vaccine should get it. There are some states that are putting that barrier that you need to have some proof of having a certified condition to be able to get it. Maryland has put that aside, so anybody who wants it can get it. The biggest issue we've had is people from DC and Virginia coming to grab our slots. Now, it is going through insurance, so you may find that this pharmacy doesn't take your insurance, and so you need to go somewhere else, but it should be covered and you should be able to find a place that's getting it. I would say if you are having trouble or you're hearing from pharmacies that they aren't stocking it or don't have it or are making you jump through hoops to get it, please let us know so we can address it.
All right. Thank you. And I know you called Sean Mr. COVID, but he is also the local president of the Josh Allen fan club out there. So, and anyone has a question about the Buffalo Bills, you should definitely address Sean with that during today's call. So I want to point out a few other data points or some developments for the county. Probably, hopefully people know that the county executive has nominated Gabe Albornoz to be our new director of the Montgomery County Department of Recreation. Gabe spent many years, I think 10 years, as the director of recreation during the Leggett administration. So he spent the last 7 years as a member of the county council. You know, the county executive was so impressed with his range of knowledge, not just with his prior experience with recreation, his work before with dealing with the needs of young people in our community. He has been the chair of the Health and Human Services Committee on the council, on the Education Committee. So he is well steeped in how we provide services to the children and families of our community. And therefore, the county executive was very excited that Gabe was interested in rejoining the executive branch and taking on this leadership role of the department as we seek to grow and entice more people into activities with our Department of Recreation. You know, during the Eldridge administration, we've made our rec centers, other than the aquatic centers, but all the gyms, the services, and access to the healthcare facility, the fitness facilities in our rec centers are all free and continue to be free. So we put out a range of amazing services through the Department of Recreation, and we expect the department will only continue to excel under the leadership of Gabe Albornoz. I know you can get information on the County Council website about how the council plans to fill the vacancy for the seat that Councilmember Albernos will be vacating. The council won't be taking up his nomination until December. So members of the press, you can look forward to that in early December. This is Economic Development Week across the state of Maryland. The county executive is doing that through his international trade mission. But there are events happening all over Montgomery County and the state of Maryland to highlight the what is happening in economic development in our community. So great time to celebrate a local business, thank a small business, go out to a restaurant and enjoy Economic Development Week. It is also Cybersecurity Awareness Week across our country, and or month, Cybersecurity Month. So people in Montgomery County should know that we take cybersecurity very seriously as an organization. We do, each and every one of us has to do monthly trainings to follow up on exactly what we need to do to keep all of our private data secure in Montgomery County. Obviously, Dr. Davis knows through HIPAA that we store lots of information about people, and we take this very seriously in Montgomery County. We hope all county residents, businesses take this issue very seriously. Sunday is Halloween in Wheaton, so it's the beginning of the Halloween holidays. Come out, get dressed, put on a costume, make some pumpkins, decorate some pumpkins in Wheaton on Sunday. And of course, the one and only David Sedaris is performing at Strathmore Sunday, which is a big thing because, again, Strathmore, a magnificent music center that is only busier than ever as acts that once may have entertained at the Kennedy Center are looking for another venue to perform in the Washington region. And certainly the Strathmore Performing Arts Center is filling that void. You know, it's going to get darker earlier. We're going to be changing the clock soon. It is critically important when we think about Halloween or we think about any day of the week to be careful with pedestrians. Remember, there are going to be children walking home, people walking home from the bus stop after work in dark, in dusk. Please be aware of pedestrians on the roadway. Please walk safely as a pedestrian. We continue to see too many injuries and even deaths in our county because of interactions between cars, bicyclists, or pedestrians. It's horrible. It's horrible for any family to go through, but just take a moment as we get into the season when we see, in fact, right, the largest number of injuries for bicyclists and pedestrians because of that early sunset that will start occurring. So just please, and for the press, reiterate to our drivers, our bicyclists, our pedestrians, that you have to be extra cautious this time of year, and especially on Halloween evening. So with that, Dr. Stoddard, do you have anything to add?
Yeah, I just have a couple notes. I want to, obviously it's been a tough week for the fire department. We lost a former fire captain, Sean Reagan, who's retired, passed away after a long illness. And then we found out over the weekend that active firefighter Chris Kindle with Fire Station 14 passed away, untimely death as related to a job-related cancer. So obviously, I want to take a moment to recognize them and offer our condolences to their families and to their station mates, to the entire department for those losses. It reminds, as Dr. David said, the importance of getting early screening for cancers. We know that's extremely important within our fire rescue services. They are at greater risk of a number of different cancers. And so obviously that's an increased area of emphasis that we have in partnership with our International Association Firefighters, Local 1664. So I also wanted to say on Tuesday I had the honor to represent the county executive recognizing Domestic Violence Awareness Month this month. It's important. We actually just about a little over a week ago, we had a domestic violence related homicide in Montgomery County. In Montgomery County, domestic violence is one of those things where our homicide rate is very low, but it is one of the unfortunately more regular causes that we see is intimate partner violence, people who live with others And obviously, in the case of the homicide week last week, Miss Monique Charles, she was returning home to Brooklyn when she was shot while talking to her mother. These are situations where they're terrible. There had been a history of stalking and domestic violence in that case. But obviously, if you know someone who's struggling with domestic violence, please have them come report to our Montgomery County Services. They can call our crisis center. They can access the Family Justice Center, operated by our sheriff's office. There are resources. There are free resources available for people who are experiencing domestic violence or stalking or threats of violence. Please come forward before violence becomes a part of your life or someone you love's life. So just want to break this. Thank you.
All right, thank you. Are there any more questions, especially from Chaley with Bethesda Today?
Yeah, I mean, I guess just if Dr. Sauter, if you've heard anything back on the front as far as the impacts to nonprofits or the SNAP benefits that were that the council was briefed on last week.
So I've been texting. I was off on the side texting. I haven't gotten back an answer on the nonprofit grants piece. I'll reach out to Ms. Bruskin and Mr. Murphy about the nonprofit grant impacts, particularly on those things. On the food side, I know I actually was having a conversation with Oscar Mentzer, who is the county's human service officer. He was on call this morning. They're literally right now at the state of Maryland level trying to figure out exactly what's going to come on November 1st with regard to SNAP benefits. There's not a reappropriation for that period. And what that will likely mean is there's potential for either a delayed benefit or a reduced benefit based on what they're able to figure out over the next 9 or so days. Obviously, if the government reopens anytime between now and then, there's a reappropriation, things can move forward pretty seamlessly. But if we get to November 1st and there has not been a reappropriation, there very well may be impacts. I just can't tell you what those are going to be yet because the state is attempting to figure out some alternatives that might be able to mitigate some of those federal reductions. So certainly more to come on that. It's going to be a focus area for our food support networks, both in the Department of Health and Human Services and our unique Office of Food Systems Resilience in Montgomery County.
Thank you.
Pete.
So I understand you're going to get more on SNAP for us, but I do wonder, do we have a dollar amount if it is not reappropriated for November? Is there a blanket dollar amount? And again, I know it's hard to trace because these are grants that go out to specific entities, right? But is there a ballpark, like if we don't get it, that's X millions of dollars that won't come to these agencies in Montgomery County and nonprofits that feed people?
I'm sure we could find it, Kate. I don't have it at top of mind, but certainly I'm sure we have some projection of what loss of SNAP benefits would mean for Montgomery County. I will say our food providers, largely our nonprofit network, who does a lot of food division. You've seen. I heard Craig Rice, the executive director for MANA this morning, that they are absolutely seeing an increase in people coming in. And obviously they're sort of calling for philanthropic donations, which I'm sure Montgomery County, as it always has, will step up. But we'll get you a number on what the SNAP reduction would mean in terms of lost benefits on for every week or month that this shutdown continues.
Thank you very much. Appreciate it.
Kate, just off camera, is a very crestfallen Scott Peterson, who's appalled that we don't have the answer for you, but we will get you an answer. He's made it clear to us. Okay. Kate, your hand is still up, but I assume you're done. All right. Any other questions? All right. Thank you all very much for attending today. We'll get you those answers and have a wonderful afternoon.